Welcome to the Modern Psychedelics podcast. Thank you so much for being here and choosing to spend some time with me today. I'm your host, Lana. This is the place where we explore how modern humans can work with psychedelics and plant medicine to engage more deeply with life. You can expect balanced and grounded conversations around therapeutic, spiritual, and recreational containers. All right, let's journey. Footwear has always been a huge issue for me. The problem is I want to look cute, but I'm also so over those fashion shoes that make my feet hurt and my bunions worse. Earth Runners have solved all of my soul's problems. Their earthing sandals are not only comfortable, not only mimic barefoot living, but also look pretty damn cute with all my outfits. I recently got a pair for my 6 weeks in Costa Rica, and I am not kidding you guys. I did not take these shoes off. They were the only footwear that I brought with me other than my hiking boots, but honestly, I could have left those hiking boots at home. My feet feel like they're finally starting to heal after all of the damage I've put them through over the years. I can walk for long distances and my feet just don't hurt like they used to. I am obsessed. I have found my shoe for life. Made with Vibram outsoles for a responsive, sure-footed experience, these smart sandals are appropriate for hiking, long-distance running, not that I do any of that, water adventures, festivaling, I definitely do that, and integrating with the earth. So the stainless steel copper earthing system grounds you to the Earth's electromagnetic frequencies, which has a number of health benefits. You guys can research this: reducing inflammation, connecting to the circadian rhythm, better sleep, pain reduction, and some other stuff. The ultimate integration for me is living in alignment with the earth. And I love any products that help me do that. Free your feet and rewild your soul with Earth Runners. Just go and get a pair for the summer season and you will thank me later. I'm currently sporting the Circadian Adventure model and I'm about to go grab another pair because I'm that obsessed. Visit earthrunners.com and use Lana, Lana, at checkout for 10% off. That's earthrunners.com and Lana at checkout for 10% off. Hello. Welcome back, everyone. If you're new here, welcome. Super happy to have you here. Modern Psychedelics is really at the intersection of psychedelics and creating purpose and meaning and fulfillment in life. So my platform is all about how we can work with psychedelics to create a more meaningful life. I'm also a certified professional coach, so you can see why that's my intersection. If you've been here for a while, thanks so much. Thanks for continuing to come back. It means so much to me, and I am wondering how you guys' summer is going so far. I've definitely been taking advantage of festival season. I have a festival a month this year. And yeah, I'm actually just about to go to the second one of the summer. So yeah, it's been really fun over here. I hope yours has been exactly what you need. And today's guest is Kyle Greenway, Dr. Kyle Greenway. And this is actually kind of a big deal that we got Dr. Kyle Greenway on the podcast. He keeps a super low profile. I think he's only been on one other podcast before. And he is a pretty sought after ketamine researcher in the ketamine space. So this is really I wanted Dr. Kyle Greenway to be the one to teach us about ketamine. I know about him because my friend actually works with him at their clinic in Montreal. So that's how I had the connection. I got really lucky. But he is the one who I wanted to have on to do this Ketamine 101 and Beyond episode. There's a lot of ketamine clinics that reach out and I don't know. I just knew Kyle Greenway was the person. He's been on my radar for many years, and this is the ketamine episode we've all been waiting for. So ketamine is not technically a classic psychedelic, but it does behave like one. And anyone who's had ketamine out there You'll know what I mean. Many researchers and scientists in the psychedelic space consider it to have psychedelic properties and are applying the psychedelic-assisted psychotherapy model to its use. So this episode is really just a treasure trove of information for those who are considering ketamine for treatment. And we really talk about it for treatment-resistant depression and other conditions. And it's also a good episode for people who want to learn more about this chameleon drug. So Dr. Kyle Greenway refers to it as a chameleon, and you'll understand what that means after you listen to this episode. It really is a very special substance. So beyond his academic accolades, Dr. Greenway is actually really fun to learn from. Even though this was quite an academic episode, which I don't really do many of those, it was fun. It was fun talking about a serious subject matter. And so just to read Dr. Greenway's bio, so he is a psychiatrist and assistant professor at McGill University. He completed a research fellowship at Imperial Psychedelic Research Center and co-led the development of 2 academic clinics utilizing ketamine in treatment-resistant depression. These clinics are amongst the only services in the world to provide ketamine-assisted therapy in public healthcare systems. So we'll be talking about what he calls the Montreal model, and that is really this public access system for ketamine. It's potentially the only one in the world that offers ketamine therapy for people through a public system. We also just talk about what is ketamine, its really interesting history, why ketamine is so dose dependent, why it's considered a chameleon drug and also a tiger drug. We talk about how ketamine actually started to be used for these mental health conditions outside of hospitals. We talk about ketamine versus classes psychedelics, both pharmacologically and in terms of its applications for dealing with different mental health conditions. We talk about the afterglow or antidepressive effect of ketamine. We talk about risks with abusing ketamine, such as ketamine bladder, who might benefit from ketamine, and why the inner healing intelligence might actually be a harmful concept, and more. So I learned so much from Dr. Kyle Greenway. It was so nice to have him on. I definitely had a very limited understanding of ketamine, and I feel so much more empowered, and I know you will too. So enjoy this episode, and thanks again, Dr. Greenway, for coming on the podcast. Are you interested in microdosing? Well, I have an invitation for you. I'm hosting a free workshop with my Flow Formula co-captain, Jenny. Join us on September 6th for Microdosing Psychedelics, the energy of flow versus force. I'm so passionate about this topic. We've all experienced the energy of flow at some point, and we know that it helps us tap into creativity, fulfillment, joy, which leads to desirable results and just a better life. But why is it so difficult to integrate the energy of flow into our day-to-day life? Most of the time, our default tendency is to get things done by using the destructive energy of force. While force may get things done, it's not sustainable or fulfilling in the long run. There are a few hallmarks of the energy of flow that we're going to discuss during this workshop and talk about how it applies to the practice of microdosing. We're going to be exploring how you can connect with the energy of flow and drop the energy of force so that you can move forward in your desired direction, whatever that is. We'll also be discussing how to treat microdosing as an integrated practice in your life. Both Jenny and I are experienced and passionate about this topic. Save your seat by clicking the link in the show notes, and we can't wait to see you there and connect with you face to face. The last time we ran this, we had so much fun connecting with people in our communities. We'll also be doing a special live giveaway for all live attendees, so we can't wait to see you there. We will be providing a recording after, but attending it live is really going to be where all the magic is. So sign up again using the link in the show notes, and we'll see you there. Hello, and welcome back to the show, everyone. I'm here with Dr. Kyle Greenway. Welcome to the show.
Hi, it's lovely to be here.
Yeah, thank you. And you're calling in from Montreal, which is my favorite city in Canada.
Mine too. That's why I'm here.
The best. Yeah. So exciting. So can you introduce yourself to our audience?
Yeah, sure. So I'm a psychiatrist at McGill University, doing the clinician scientist pathway, which means some time protected for regular psychiatric work and a lot of time protected for clinical research. And And I'm here, so you could probably guess that most of my clinical research is regarding psychedelics.
Can you tell us a little bit about the work that you're doing in Montreal? It's very unique in a way.
Yeah, I think the cornerstone of our work is our ketamine for treatment-resistant depression clinic. We are operating at the Jewish General Hospital now for a little while, a couple of years. And before that, we were at the Douglas University Institute. And I think what's unique about it is that we are doing ketamine-assisted psychotherapy in a model of our own. We call it the Montreal model. Actually, we're talking about Montreal, which is a bit of a hybrid of a psychedelic, a model with some of the most evidence-based interventions of conventional psychiatry. And it's something that we can offer to real-world patients without charge, which is, I think, extremely unique in the world, with the caveat that we have a small capacity. And it's mostly at this moment restricted to patients in our hospital sector.
Wow. Without charge, that's definitely, you don't hear of that. Can you tell us a little bit about that and how it's like a public clinic?
Yeah. So there are clinics that are able to offer intravenous ketamine or even Spravato intranasal ketamine to patients for whom it's indicated without a direct charge to them, either through private insurance or through a public payer system like we have in Canada. The hard bit is finding a way to cover things like the psychotherapy, the psychological support during the treatments. And so our model has been, with the generous support of funders and some charitable donations from the Jewish General Hospital Foundation, our model has been to essentially use the public system for the drug costs and then use some research funds to cover the costs of psychological support and accompaniment, because we believe it's at least essential to optimizing the benefits, if not for safety, of ketamine.
Yeah. So is that unique to ketamine specifically because of the legal status of it? Is that why you're able to pull this off?
Yeah, there are already, Quebec in some ways is leading the world a little bit in terms of having government paid access to psychedelics, because some colleagues have treated patients with psilocybin under their Canadians Compassionate Access pathway. And physicians are able to be reimbursed by the public system for their time to administer those treatments. It doesn't pay very well at all compared to, say, conventional medicine, but it's enough that it is at least symbolically very important. But beyond the compassionate access routes, obviously there's not really any psychedelic that is Health Canada approved for any indication. And of course, as ketamine is approved for depression, ketamine is approved only for anesthetic or pain indications, then we use it off-label based on really compelling evidence that it's an effective antidepressant.
Okay, perfect. I'm really excited to see what happens in the future with the Montreal psychedelic scene. I'll definitely keep posted on that. I want to get into a little bit of Ketamine 101. We haven't talked too much about ketamine here on the show, so I'm on a learning journey with my listeners right now. Can you tell us what is ketamine?
So I warned you that I would ask you just to tell me, or just free associate, what do you know about ketamine? What are the labels? What is it used for, et cetera?
Yes. So I can draw from my knowledge and experience, which is very limited. I definitely have used this on the dance floor, and that's how I use it in like very small quantities. But I know that it's a dissociative. It's not a classic psychedelic, but it acts like a psychedelic, that it's very dose dependent. You get very different results with different doses.
Totally.
And that it's often referred to as like a horse tranquilizer, that it's been used in the medical industry for many years, and that there is the possibility of entering a state called the K-hole, which I've never gone to, nor do I really want to. But that I know a lot of people have a fear of that. So yeah, that's why I always take it really slow when I'm using this recreationally. So how did I do?
You did well. I'm not going to comment on recreational stuff today, but I do think you nailed some of the key elements for me, which are the plethora, the multitude of words that we all know to describe this drug. We have dissociative, we have psychedelic, we have K-hole, engenderer, we have horse tranquilizer. Yeah, that's what's so interesting about ketamine is it is a chameleon of sorts. So I can tell you a little bit about it. The most basic thing to know about ketamine that you'll see on every article about it is that it's a NMDA antagonist, which is a glutamate receptor in the brain, which is to say it's a receptor that is largely or strongly linked to neuroplasticity. But ketamine also has a sort of paradoxical effect. So on one hand, it seems to increase excitation of the brain, which makes information travel more freely, very psychedelic. And on the other hand, it seems to also put the brakes on that process almost at the same time. Some people call it the stop and go mechanism. And it's this paradoxicality, these almost competing mechanisms that I think one could argue is responsible for the profound dose dependency, how the effects differ dramatically at different doses, which is totally atypical for anything in the broader psychedelic family. For example, LSD at 1,000 times the normal dose is going to look like a really intense experience, but it's not necessarily going to look totally differently. Whereas ketamine at a low dose, it can be very psychedelic. At moderate doses, people talk about ketamine dreams or transpersonal experiences. And at the anesthetic doses, people are really just switched off to some degree.
Okay. And which dosages are you guys working with at your clinic?
It's another interesting thing. What you'll see in the literature or in the popular press even is that the classic sub-anesthetic dosing, this is the dose range most often used in biomedical studies. The idea is that it causes mild dissociative symptoms, but it's not very psychedelic. It's not the same thing as the private clinics that use a psychedelic model. What we found as a surprise, to be honest, is that the sub-anesthetic dosing, so relatively quite low, really, 0.5 milligrams a kilogram for people who know about dosing, is enough. If you provide blindfolds, if you provide accompaniment, music, it's enough to produce profound psychedelic effects. And it's the dose range that has the most evidence in the literature for anti-suicide or antidepressant effects.
Got it. So you also referred to it as being a chameleon. I've never actually heard of ketamine referred to in that way. Can you tell us a little bit about that and how that works?
I would love it. My only legacy in this world is that ketamine is referred to as the ketamine chameleon. I'll go to my grave happy. It's a little bit in response to Edward Domino. Edward Domino is the chemist or one of the scientists who helped develop ketamine back in the 60s. And he wrote several articles that I highly recommend hunting down about how difficult it was to understand this drug and for it to find its niche in medicine. And this is before ketamine went on to become probably the most common anesthetic agent in the entire world. It's been on the WHO essential medication list for decades now. But he wrote these articles, and that process of trying to find a niche for ketamine was called by him as taming the ketamine tiger. And I think this is hilarious because it speaks to the challenge of this drug. And I also think it's not very apt because in the right circumstances, ketamine is not this aggressive, feline, dangerous creature. It really is a drug that I think is better described as a chameleon because it's so context dependent. So context dependent. It can look like a dissociative in the sense of mimicking the dissociation of PTSD or borderline personality disorder, etc. When it's framed that way, and when you badger patients with questions that lead them to understand their experience in that language. And it can look extremely psychedelic when you use it in a traditional psychedelic-assisted psychotherapy setup. And then it can be a bunch of other things. I don't know how much we want to go down this rabbit hole. Ketamine has, in some ways, found itself at the center of a lot of big forces in our society. For example, ketamine is being used mostly inappropriately in big doses to anesthetize or sedate people. It's something called delirium sedation or excited delirium sedation, where paramedics will give massive doses, 10 times or 100 times what we would use to people to sedate them if they were agitated. And this has been central to a lot of criticisms about racism. Obviously, there's a disparity in who gets sedated in this way that has killed people. Ketamine is deeply involved in the COVID pandemic because of the relaxed prescription rules for virtual care. And that's what led to a proliferation of companies doing at-home psychedelic therapy, or at least at-home sublingual ketamine. It goes on and on. Ketamine was centered in the Vietnam War, where it was called the buddy drug because it was so easy to give soldiers this little vial of ketamine to administer to a colleague, a buddy, if they were injured. On and on. It's a very interesting drug.
That's so funny. I know we're not talking about the recreational containers, and that's my only orientation with ketamine, but I always call myself like the ketamine kitten, and the tiger is like my spirit animal. So I'm just having like major moments right now. Wow. But back to the serious stuff. So at what point was it discovered that this medicine actually works for treating these psychospiritual and mental conditions? How did that happen? How did it go from the hospitals to clinics like yours?
Yeah. Again, a fascinating story. And I'm biased, but I really do think there's something about this drug that is compelling. It was synthesized as a derivative of a drug that was called Serenil. And if you don't know Serenil's brand name, you probably know its generic name, which is PCP. So Serenil, PCP, it didn't last long in the armamentarium of medicine, and obviously huge problems with recreational abuse of PCP. And then ketamine essentially was searching for its role in anesthesia. It found its role in Vietnam War, as I mentioned. But very early on, psychiatrists in places like Iran, in South America, in Mexico, recognized that it could produce psychedelic experiences. And that story had largely been written out of the conventional narrative of ketamine. But there are some studies of hundreds of people published in the USSR in the 80s and 90s that show ketamine being used in clinical trials against neurosis. They didn't really use modern language for mental health conditions, addictions, trauma, you name it. But the first kind of real foray of ketamine into biomedical psychiatry was a really small trial, 7 people in the year 2000 by John Crystal's group. And that trial showed this kind of hallmark that has made ketamine famous since then, really rapid antidepressant effects that last not a long time, but certainly longer than the drug is in the system. So different than something like if you gave somebody cocaine, you might find their depression improves briefly, but they're not feeling great the next day, for example. And so this rapid but transient antidepressant signal for ketamine was really convincingly demonstrated for the first time in the year 2000. And since then, the evidence has just continued to accumulate for it. Yeah, so it's interesting. I mean, the drug itself is not that old, and it's a very strong contrast to most psychedelics. It's called ketamine a psychedelic, where obviously there are centuries and millennia of traditions in many cases. I guess it's similar age to LSD. But yeah, it's only in the last 20 years or so that ketamine has really really accumulated a lot of clear clinical trial evidence.
It really is. I see it as like it's standalone. Like I can't really compare the effects of it to any other substance. I do feel that it really stands out on its own. And I'm thinking that it's because it's classified as a dissociative that act like a psychedelic. So I would actually love for you to touch on, even though this is classified as a dissociative, why is it that it acts like a psychedelic or even gets put into the lineup of psychedelic drugs?
Yeah. Again, I'll try for brevity, but we could talk for hours just about this one question. The first thing I'll say is that the original name proposed for ketamine by Edward Domino was not a dissociation. It was dreaming. And it's really a sad twist of history that the label dissociation stuck somewhat arbitrarily. The name basically came from either the fact that people seem a little bit disconnected from their environment, which is maybe the common sense understanding of the term, or from just electroencephalography and brain electricity signals showing essentially a desynchronization between the frontal and parietal areas. In other words, this somewhat arbitrary EEG finding was used to justify the name dissociation, which ended up becoming the definition or the identity of ketamine, as opposed to dreaming, which again, I think is in many ways a better term. But as early as the 70s and 80s, people were already pointing out that even though ketamine is a dissociative and say LSD or psilocybin or psychedelics, this was somewhat meaningless, this distinction between them. But we didn't really, I think, have good evidence for arguing that ketamine should or could be considered a psychedelic until the last 20 years or so. And I think some of the most obvious forms of evidence are if you give people standardized questionnaires to try to understand what their drug experiences are like, and you compare ketamine, psilocybin or LSD and MDMA, you'll find a lot of overlap between ketamine and the classical psychedelics. A lot more than there's overlap with MDMA, for example, on things like illusions or hallucinations, changed meanings of precepts, which is a very nerdy way of something very psychedelic, very like the altered sense of meaning that we attribute to things. And essentially the one thing that really distinguishes ketamine from these other two kinds of drugs is that it does produce a lot of disembodiment. So people do feel like their body is far away or their body is distorted. But I would argue this is a bad justification for the word dissociation, because dissociation has so many connotations beyond just your body feels weird. And then I'll say now, very recently, we are accumulating a lot of neuroimaging evidence that shows that indeed there is a lot more in common between what ketamine and classical psychedelics do to your brain acutely in terms of how the circuits run than you would think. Despite them having really different pharmacologies, they both, for example, both classical psychedelics and ketamine decrease the integrity of brain circuits that traditionally in your daily life roll together and increase the connectivity between disparate brain circuits. So in other words, information is flowing less through kind of those hard trodden paths and more freely in the brain. And I think this is probably a universal finding we'll see with everything that can be labeled a psychedelic eventually.
Yeah. And what about that antidepressive effect or that afterglow effect with ketamine? Can you tell us a little bit about that?
It's mysterious a little bit. There's a few kind of hand-wavy ways one could understand it. Ketamine in some ways, because it works on glutamate, is a little bit like the anti-alcohol. So despite there being some kind of overlap between people's ketamine experiences and sometimes being intoxicated on alcohol, chemically, they're almost polar opposites. It's a question of GABA versus glutamate. And so if you know what it feels like to be hungover, and that's produced by essentially your brain being flooded with GABA from the alcohol, the next day you're in this kind of hyperglutamate state. Ketamine is almost the process in reverse. That's one kind of hand-wavy way to look at it. And then there's also the argument of ketamine increasing neuroplasticity, and we have good evidence in cells, in animals, et cetera. That is the case, that you can show that the right dose of ketamine, not too much because that is actually neurotoxic, but the sweet spot improves dendrite spining, so it improves essentially your brain's ability to make new connections. That itself might be associated with feeling a little bit better, or at least correlated with it. And then obviously for those of us interested in the psychedelic model of any kind of substance, there are good reasons to think that the experiences in the right settings can be beneficial. Make people feel better the next day, weeks later, months later.
That's fascinating. And are there obviously higher doses can be toxic to, is it the gallbladder?
The
right?
urinary bladder.
The urinary bladder, yeah. So obviously that's something to be mindful of, but is ketamine something that is lethal? What are the safety implications here that you guys are considering?
Probably the best evidence that too much ketamine can be lethal comes from, as I mentioned, this use, which I think is inappropriate, of big doses of ketamine for sedation of agitated people, because there have been numerous deaths reported from that. Ketamine is also, how should I say it, chronically, there are definitely real harms associated with using it on a regular basis at big doses. That includes the bladder problems you mentioned. There's something called ketamine bladder or fibrosis of the bladder, which is often permanent and debilitating. There's definitely cognitive issues that have been associated with abusing ketamine. And I think all those things are worth keeping in mind and are good arguments against just taking ketamine every day or frequently for the rest of your life. My understanding of the optimal use of this drug, all psychedelics, is they are there to facilitate a therapeutic process. They are not there to be just an escape, because that you may as well turn to alcohol or opiates or any other pharmacological escape if that's the goal.
That's really important. So I feel like we've gotten so much information here about ketamine 101. Is there anything else that I haven't asked you that you want to tell people about ketamine?
I think just one other reason I think that there's this kind of chameleon effect. In the psychedelic world, we talk a lot about the value of experiential learning. And for a lot of people, the idea that you would have psychedelic therapists who haven't experienced psilocybin, but are giving psilocybin, a lot of people think that makes no sense. And there's a debate about the ethicality of that. There's a debate about the access questions of that. There's many debates about this idea. What I would say is that I think in the classical psychedelics, there's many good evidence of recreational use of these drugs driving research questions, even driving the creation of questionnaires that are then used in clinical studies. Like the emotional breakthrough inventory was created by Imperial based on recreational surveys. Ketamine is, in some ways, it's at least up until now, I think it's been almost derailed a little bit by the recreational use. In the sense that a lot of people who do ketamine in small doses or frequently at parties and stuff like that, I think have come to somewhat erroneous conclusions about the drug. They often double down on the dissociative explanatory model that ketamine just makes people feel woozy and that's fun. Whereas in the right settings, with the right preparation, it is profoundly psychedelic. it really does produce really meaningful experiences for people. I think that somehow, I don't know, I think it's a funny case where there's almost an anti-experiential learning effect so far with ketamine.
Can you explain what you mean by that?
What I mean is, if there's the argument that people, therapists or researchers' use of mushrooms, et cetera, have really informed how they understand the drug, how they research the drug, how they become good clinicians in administering it, et cetera. I think ketamine thus far has been a little bit derailed by people applying their own recreational experiences to understanding what this drug is about or how it should be used therapeutically. And I'll just say, we started working with ketamine because it was available, because it was possible to say this has excellent evidence as a biomedical treatment of depression. And that gives us the flexibility then to do things like experiment with different aspects of set and setting. And that's really where our interest came from. But we initially thought about ketamine as, I think Matt Johnson called it a hippie heroin, or in other words, a shoddy psychedelic. And well, we were just really surprised. I am still frequently surprised by, just in the right setting, how profoundly psychedelic it is, how it meets every criteria. And in fact, would be really hard to distinguish from classical psychedelics if you just listen to people talking about their experiences.
So interesting. So I need to ask you at this point, how do you define psychedelic? Because there's so many definitions floating around. How are you defining it?
Yeah. I have a good friend who said something like, it's so funny we talk about psychedelics and we don't talk about the hallucinations. It's so central. When we say mind manifesting, I am of the belief that every drug that alters your consciousness, whether it's mushrooms or alcohol or Benadryl or whatever it is, the effects are fundamentally both a combination of the biological effects and the effects of your mind, who you are, the context, who gave it to you, the dose. All these things are intersecting. And so in some ways, every single drug that has psychoactive effects could be described as psychedelic or mind manifesting. And then, of course, if you take that definition, then things just become so blurry that there's no utility in the term anymore. I tend to think that there is something valuable about thinking about the hallucinations, that like vividly experiencing or being immersed in your unconscious or your subconscious. That, I think, really only applies to the things we think about as psychedelics and not things like Prozac or Benadryl, et cetera.
Yeah. So what's unraveling for me hearing you talk is I have such a hesitation towards the word hallucination when we're talking about psychedelics, because for me, it like devalues these visionary states. That's just how I feel. And what I'm kind of thinking here is, are these visions or hallucinations pulling us further from reality or closer to reality? Because I'm thinking that these like drugs that we call classic psychedelics in a way push us closer to reality, whereas some of these others like alcohol and whatever might pull us further away. What do you think? Am I onto something here, or is this totally nuts?
Oh, yeah. That's an interesting instinct. I align with it to some extent. I think somehow non-psychedelic psychotropes get a bad rap a little bit. So if you consider Prozac or something like that, it's a very effective treatment of depression. We have very good evidence about that. It's been used for a long time. But there's this idea that antidepressants work by numbing you, whereas psychedelics work by, as you say, almost get in touch more with what's there. And I think there's an element of truth. I think certainly some people report being numbed by antidepressants, but at the same time, there's a really strong argument to be made that any altered state, antidepressants included, are inevitably determined by your environment. In some ways, they magnify the influence of your environment. And there's just great studies on rats, for example, that if you induce depression in rat models and you put them in an enriched environment and you give them Prozac, they do really well. And if you put them in an impoverished or a challenging environment and you give them Prozac, they do worse than if they weren't given Prozac. So in other words, you're seeing the same kind of environmental effect magnification with antidepressants in some studies.
So here's my not so secret. The number one tool in my toolkit, the thing that has changed my life for the better the most, aside from psychedelics, of course, is not therapy. It's not breath work. It's not meditation. It's not even the yoga I've been doing for 15 years. It's coaching. because coaching is the most actionable tool that I have come across. A few years ago, I fired my therapist and hired a coach, and working with a coach helped me start moving in the direction I wanted to move, and I finally stopped feeling stuck. I fell so in love with coaching, even though I wanted to become a therapist at that time. I decided instead to get trained and certified as a professional coach. As a psychedelics informed life coach, I work with people who are on the psychedelic path, which is probably you if you're listening to this podcast. The Global Coaching Client Study from the International Coaching Federation shows most clients who work with a professional coach report improved work performance, more growth and opportunities, greater self-confidence, enhanced relationships, more effective communication skills, better work and life balance, and an improvement in wellness. According to the same study, 99% of people who were polled said that they were somewhat or very satisfied with the overall coaching experience. Coaching works. I see similar results amongst my clients every week. You can actually read their beautiful in-depth testimonials on my website at modernpsychedelics.net. Along with being psychedelics informed, my style is process oriented. We live in this outcome obsessed world where our default mode is to live life for the destination or the end result. But I have come to understand that the gifts are actually in the journey, and that's where we grow and learn and enjoy life the most. So that's why I equip my clients with tools and skills for the long game of life and the long game of medicine work. I'm currently onboarding new one-on-one clients into my coaching practice. So if this sounds like it would be supportive for where you're at, get in touch with me. I would love to hear from you. And you can click on the link in the show notes or head to modernpsychedelics.net/coaching. There's lots of info there for you along with those testimonials. I can't wait to connect with you. That's modernpsychedelics.net/coaching. Okay, let's go back to the episode.
I think really the way I've come to understand it after, I think, giving hundreds of ketamine doses is that one of the key distinguishing things about psychedelics is their acuity. That instead of a process happening gradually over weeks or months, it happens in the space of minutes to hours. And more dramatic, much more dramatic. But I would agree with you that whereas if you take Prozac and you might actually be feeling something that is really reflective of your environment, it might not be obvious. You might just think, oh, this is a drug effect. This drug isn't for me, or I'm sick, or it's because I lost my job last week. It's subtle enough that it just doesn't become apparent. Whereas if you take something like psilocybin, et cetera, what you're experiencing is in large part coming from within. It's obvious.
Yeah. Yeah, it's very interesting. Definitely something to keep chewing on, I think.
Yeah, I think so.
What makes ketamine different from other psychedelics, or why would someone want to work with this as a medicine as opposed to, say, psilocybin or ayahuasca or LSD?
I think one thing is that ketamine is more forgiving for both clinicians and for patients. There are these clinics that give ketamine in sometimes really barren conditions like operating rooms, et cetera. We've done that actually, giving ketamine in a place where they used to give lobotomies. It is not ideal, and it is worse than if you use a proper environment. But compared to mushrooms or something like that, if somebody took psilocybin and spent 1 minute in that room, they would freak out. You would learn within 1 hour that this is never something you should do again. Whereas with ketamine, there are places that have done it for years with moderate success. So there's something that is more internal about ketamine, or at least more forgiving. One of the really big differences for me in the phenomenology, and we just haven't seen good studies on this, but you see it clinically so obviously, is that if you're wearing blindfolds and you take ketamine or you take psilocybin, often there are vivid hallucinations, a vivid visual experience, visions, as you say. If you remove the blindfolds with psilocybin, oftentimes those sort of phenomena continue, but to a lesser extent. Walls breathing is a classic, very psychedelic phenomena. Whereas with ketamine, the world just looks wonky. It just looks odd. If you remove the blindfolds, it's just suddenly there's a really big difference in the visual phenomenology of ketamine versus the classical psychedelics. And I'll just say, and when I say it's easier for patients, our team, our broader team has given psilocybin to a bunch of compassionate access patients, psilocybin-assisted psychotherapy under Canada's compassionate access program. And sometimes, and especially in people who are really unwell, either psychically or physically, 4 to 6 hours is a slog. Like, it's a lot of time. And those type of patients who would find it so difficult wouldn't have made it to the clinical trial dosing day, because that preparatory process of getting into clinical trial, going through all the screenings, all the neuroimaging, et cetera, is long, and people would have just dropped out by then. But in real life patients getting clinical access, they might not be dropped out. They might take psilocybin with caring therapists and still find after 6 hours that it's just exhausting. Whereas ketamine is 40 minutes, or actually I should say more 60 to 90 minutes. So it's way more forgiving in that way.
Yeah, that makes a lot of sense. What conditions or, I guess, disorders is ketamine useful for in a therapeutic context, especially like people you're working with?
Yeah, the strongest evidence is in this kind of confusing diagnosis called treatment-resistant depression, which is defined by failing to respond to at least 2 conventional treatments at an adequate dose, et cetera. And that has excellent evidence for ketamine. In the end of May, there was a study in the New England Journal of Medicine comparing ketamine to electroconvulsive therapy for profoundly resistant cases of depression, showing that ketamine was on par with psychiatry's most effective intervention. So that indication has robust evidence, better evidence for it than there is for any other medication, really, I would argue. And then that diagnosis of treatment-resistant depression often entails comorbidity like anxiety disorders, post-traumatic stress disorder, medical conditions, personality disorders. And so almost by definition, ketamine has a good rationale in those conditions as well. And there's some evidence from smaller trials. But yeah, I couldn't say it has the same robustness of the evidence of treatment-resistant depression itself.
So it sounds like you're treating patients with a variety of conditions at your clinic?
Yeah, we treat people with a variety of comorbid conditions. It's really rare that we would get somebody who has just treatment-resistant depression. And I should add also that there's unipolar depression and there's bipolar depression. And bipolar depression, as far as we know, is an exclusion for any psychedelic drug, except ketamine. So ketamine has proven evidence of safety in that population with the proper precautions. So yeah, we focused on treatment-resistant depression, both unipolar and bipolar, and that has entailed treating almost the entire DSM of diagnoses. Probably the one thing that we stay away from are people with psychotic disorders, like schizophrenia.
Can you take us through what treatment protocol looks like, your clinic, from like start to finish?
Start to finish, okay. So I think I'll tell you, one of the big learning processes for us over the last 5 years, we've been doing this, has been, some elements of the psychedelic paradigm are not appropriate or not well suited to people who are really suffering. For example, and let's just give a couple examples of things that we've tried to work with and then moved away from. We haven't found a lot of utility in the term inner healing intelligence. It's a term that I kind of love intellectually. I think there's a lot of warmth and kindness that goes into that term. But for people who are really profoundly unwell, it feels a little bit absurd sometimes to present to them that they have an inner healing intelligence. And if there's a challenging moment or if they deteriorate at any moment, it is just so easy to say, okay, not only do I feel awful, but now I've proven to myself that I don't have an inner healing intelligence.
Oh, yeah.
You can suffer
I
twice
could see
in
that.
this way.
Yeah.
Yeah.
It's like additional wounding.
Exactly. And I have to say, one of the things I'm most sure about in all of psychiatry is that if you can find these moments when you suffer twice, where your suffering multiplies, that is an excellent place to do something different. For example, a big part of our process is to ask our patients to set some really clear behavioral goals. And for example, we know from very good evidence that exercising regularly is as effective as an antidepressant as almost any oral antidepressant, any typical medication. And yet very few of us do it. And it's extremely hard to motivate people to undertake exercise. I don't know how your routine is, but yes. And so,
I feel that.
Yeah. So a lot of our goals are to establish a plan of, say, we're going to walk 15 minutes a day. And what's nice about a goal like that is even when you feel like garbage, you can still pursue it. You can feel like crap and go for your 15-minute walk. And there's this whole, I think, Twitter phenomenon about people talking about their terrible walk or their shitty walk or something like that, but yet how beneficial it is for them. That in my mind is a definition of a good goal. a really bad goal, which a lot of people start with, and I don't disagree with in the long run, but a bad goal for a treatment process or the short or medium term is to feel happy. Because if your goal is to feel happy, then on a day when you're not feeling happy, not only do you feel unwell, but you also have failed your goal. You're also a failure. That's one of these kind of suffer twice moments. And I'll just say again, I understand depression to be mostly a phenomena of vicious cycles, of these positive feedback loops where one legitimate problem or one legitimate symptom leads to another, and you just end up completely flattened. And so our model is really based on trying to do the opposite, trying to build momentum. And we're very conscious that ketamine, for most people, can have profound benefits, but these benefits typically don't last. There are psychological insights that can persist for the rest of your life. And psychotherapy is basically the one thing in psychiatry, or the surest thing in psychiatry, that if it works for you, you can be hopeful that the benefits will persist. But otherwise, we understand ketamine to almost create like a window of opportunity. And so all of our treatment protocol is centered around how do we use this brief, let's say 1 month where you're feeling better. How do we use that to make changes in your life that will hopefully keep you well?
How are you guys using that window of opportunity? Is there additional support outside of the clinic? Are you recommending them to work with a therapist? Going on there in that window of time?
So in a nutshell, when we see people, we think they're a good candidate for ketamine. We feel like we have a good enough alliance that we can build some momentum, set some goals, and work together. And we plan for a course of 4 to 6 treatments in a month. And we ask our patients to also begin in parallel psychotherapy or concomitant psychotherapy. And this is often a little bit hard to find as you live in Canada also, how it can be challenging to find public psychotherapy for people. And so sometimes we have therapists that work with us that will provide it, and other times there are government resources, et cetera. So we ask people to have at least an hour a week with independent psychotherapists who will liaise with us. And this is one way in which we were really quite different, I think, from psychedelic models, where it's usually the same clinicians that administer the prep, the treatment, and the integration. Whereas we administer the psychedelic ketamine sessions semi-independently of the people that are doing follow-up, at least weekly, in terms of psychotherapy. And there are pros and cons to this, but it's actually inspired from the way that normally psychiatrists work, by prescribing medications and connecting people to psychotherapy and liaise, hopefully, with the therapist. But you don't necessarily expect them to be the same person. So there are pros and cons to this. I think there's major feasibility benefits. There definitely is a necessity to maintain communication. And there's also this benefit that I think it's really good for people not to become too dependent on one clinician or one set of clinicians. And if you listen to the Cover Story podcast, or you heard some of the controversy about the MDMA trials, you can hear that there are negative consequences of forming way too strong a link with just 2 therapists that you have a short time with before you leave them. So in our model, at least there's a provision of some kind of external therapies. We broaden the circle of care. And if people are benefiting and resources permit, they can continue in psychotherapy after that 1 month of ketamine has come and gone.
So 4 to 6 rounds in a month, and that would be one treatment. What kind of results are you guys seeing?
So we just wrapped up a study that randomized people. And this is what I mean about ketamine permitting set and setting research that no other drug would permit safely. We randomized people to either receive music or matched psychological support, which was generally mindfulness exercises. So people were randomized for their 6 treatments of intravenous ketamine to either have music at every session or have a therapist in the room asking them to look inwards and engage in breathing exercises. And this is it's a gold mine of data we're still working through and analyzing, but we saw some really cool things. One of them, for example, is that our hypothesis was that music would blunt the blood pressure increase that comes from ketamine, which is one of the major side effects to be worried about. And we confirmed it. So music made ketamine more tolerable, which is cool because it at least makes an argument for people in anesthesia, et cetera, who don't really care at all about the psychedelic paradigm to think about set and setting. Why not use music to lower people's blood pressure during a ketamine infusion rather than giving them antihypertensives, other medications? And in our population, you don't expect miraculous gains from most people. You're generally happy with incremental gains. And yet we saw profound reductions in depression and anxiety and suicidality. I'm not going to get to proportions, but certainly the majority of people experience a significant benefit. And really importantly, at the end of our active treatment, We only had 1 month of follow-up. I wish we had longer, but there was some logistic concerns around that. But at 1 month follow-up, all of the benefits were maintained. There wasn't even the slightest signal towards people's benefits fading. And that is in strong contrast to the biomedical literature on ketamine.
Interesting. So if someone is pursuing ketamine-assisted psychotherapy for something like treatment-resistant depression, how many rounds should they expect to go through? Is there maintenance or booster sessions?
Yeah. So we offer those as well, that from time to time. Our resources are a little bit limited. This is one downside in operating in the public system. So we're only able to offer good candidates a boost every 4 to 6 months max.
That seems like it would be sufficient every 4 to 6 months.
Yeah.
Or is this something you want to be doing like monthly?
It came out of necessity, because if you look at some of the more just biologically oriented clinics, it's every month or every couple months. And some patients have actually voiced to us that they were upset that we weren't being able to offer them weekly infusions for the rest of their life or something like that, which is something that I don't think I would do even if I had the resources for it. That's one of the big drivers we had in really trying to optimize the psychotherapy side of things, was that we just were not resourced to give boosts so frequently. And in the end, I agree with you. I think once every 4 to 6 months is enough to have another sort of brief window of opportunity to maybe break some bad habits or restart on your goals, and to consolidate some of the insights that might have come up from you in the treatments, and also to maintain that link with the team. Because a big part of, I think, any psychiatric intervention is just feeling understood and receiving kindness, feeling there's somebody you can go to if things get worse, etc. And so that serves at least to maintain the relationship, so it's not just a cold severing, which is something that unfortunately is mostly the case in clinical trials, where that's almost by necessity part of the design.
I want to put you in the hot seat for a moment. Do you think that ketamine could be a drug that could get people better, and by that be able to live their life happy where they're at without relying on boosters for the rest of their life? What do you think?
Totally. Yeah, in the right person. And it really depends on so many things. One thing I'll say is that in terms of betterment of people, I am the world's worst at this. Do you know what I mean? I feel totally incompetent when it comes to people who are mostly doing okay, as Freud would say, neurotic in the good sense, who are hoping to feel better. This is not my wheelhouse. I am, I think, very confident in my skills with people who are really suffering to get them to a normal level of average suffering. But I don't claim to be an expert on wellness, because especially right now in our society, there are so many good reasons not to feel well. And I think that's okay. I don't think ketamine is the answer. As just in the same way, I don't think that antidepressants are the answer or psychotherapy alone is the answer. I think all of us are on a continual journey to maintain our wellness, and ketamine can be a catalyst in that process.
Yeah, at least getting us to the point of being in that betterment of well group.
Yeah,
How
exactly. I guess that's a good aspiration.
That?
I mean, for Freud, that was the top of the ladder. Once you got to neurotic, you were done. You were like, that is what we have to offer you. And
there's so much more beyond that ladder, though. Yeah.
I believe it. I believe it.
I love this conversation, because your work and my work is at two opposite ends of the spectrum, because I'm a professional life coach. So typically people come to me when they're at that point where they're like, oh, I've done the therapy, I've gone through that journey, I feel good, and I want to live and be even better. So yeah, it's amazing, these
skills.
Different modalities, and which is perfect. That's exactly what the world needs, right?
I think so. Yeah. I think so. And this is the place that I feel very comfortable in with my training. And the government spends $1 million or something like that to train a psychiatrist. And so it's one of the reasons why we have done things in the public system, even though probably it's 100 hours of bureaucracy for every hour with a patient. But I feel
wow.
That's but I think it's our mandate. That's the way I understand our program is there are so many people that are really suffering. And I do think that's where a lot of the bang for the buck of the public system is, to get people to a decent level where hopefully they have the liberty to start working on their relationships, to start pursuing more meaningful professional jobs or hobbies or whatever it is. And maybe work with someone like yourself. Yeah.
For people who are listening out there and who are really identifying with being in that category of really struggling, and maybe they are on antidepressants, maybe they're struggling with anxiety, which, like, self-proclaiming that I was in that group a couple years ago, deeply in that. So for people who are listening who are there, first of all, I want you to know that you can get out of that. But I want to hear from you for people who are considering ketamine. What do they need to know about considering ketamine as an option? If they're on antidepressants, do they have to get off of them? Who's a good candidate for ketamine?
That's a great question. Well, one of the nice things about ketamine is that it's compatible with almost every medication except maybe benzodiazepines. So these anti-anxiety medications like Xanax, Ativan, etc., which in some ways in our hands, we see that a little bit as a feature, not a bug, because although those drugs are really effective short-term treatments of anxiety or even just the anxious distress of a beginning depressive episode, I interpret the evidence that in the long run, those medications, because they're depressogenic, tend to just reinforce vicious cycles. And we have some evidence that those medications, anti-anxiety medications like Xanax, Ativan, actually reduce the benefits of psychotherapy because in some ways psychotherapy is driven by tolerating distress. And if you just very effectively drug away the distress, there's not much room for growth to some extent. Whereas I think a lot of as I mentioned earlier, I think a lot of the people in the psychedelic world tend to pull antidepressants or other treatments from mainstream psychiatry. And that is not my view at all. I really do think these things are profoundly helpful, especially for people in the more severe category. Good. Okay. Wonderful. Because there's a story of antidepressant numbing, big pharma, bad, psychedelics, mushrooms, nature, spiritual, good. And in some ways, it's very interesting that ketamine is a bridge between these paradigms. Big pharma, yes, spiritual, often, but anyway. So I think for somebody considering ketamine for depression, I would say a few big things. One is that it is a drug that can be considered a dose of instability in one's life. And that is in many ways exactly what you need to get out of a depressive episode, or to shake the snow globe, so to speak. But it requires adequate support to go through that process. And a lot of people with severe depression also are very lonely and lack in social support. And whether or not ketamine is the answer, if you don't have anybody in your life who can at least pick you up from the treatments and debrief with you, I tend to think it's not the right time for this medication. And that was one of the reasons also we started asking our patients to have at least an hour of psychotherapy a week alongside our process, because many people didn't have a single person they could talk to about really just potentially challenging or intense or joyful or scary content that came out of the experiences. So I would say you need a modicum of social support to go through a difficult process, a potentially challenging process. Then I would say, I think one of the less obvious truths about all psychoactive drugs is that they are so fundamentally determined by our narratives. Their experience of them is determined by our expectation, consciously, unconsciously. It's determined by whether we feel good with the prescriber. Or we take an antidepressant every day at home and you see the prescriber's name in your bottle. If you think they're a dick, it is not going to be as effective. If you see that name and you're like, that's right, that doctor understood me. That doctor listened to me. And we dismiss these things as being placebo effects that we should minimize in high quality research. But I think they're just part of human nature and they should be embraced in some extent. And that is to say that I think one needs to have a clear trajectory, a frame around ketamine treatments, a good alliance with the person who might be administering it, a shared understanding about why it would be useful if one is to really get the maximal benefits out of it. And this is something that is a core component of what we do. We don't proceed with scheduling treatments or getting started with somebody until we really feel like there's a shared understanding of why they're depressed, what would make them feel better, and how we're going to work together. And I have heard some bad stories from private ketamine clinics where essentially the requirement for whether you'll be accepted is you meet basic criteria for depression and the check cashes. And I'm strongly uncomfortable with that model. I don't think it's even safe, to be honest.
Yeah, it'll be interesting to see how hopefully the accessibility changes over the next 5 or so years. And you guys are really leading the way over there with the model the Montreal model that you built there.
Yeah, I think in some ways that has been this fortuitous turn of events where we have had the chance to get a preview of what the coming psychedelic revolution or renaissance or whatever we call it, what it will look like in the real world. And spoiler alert, things will look different than clinical trials. I think we just need to accept that.
Life is not a science experiment.
But even, again, back to the narrative, if we take the somewhat simplistic idea of I go through a psychedelic trial, I have a mystical experience, and I'm cured or I'm much better, will a mystical experience have the same impact on us when your hairdresser is talking about their mystical experiences, your neighbor, your mom is talking about her mystical experiences? Probably not. Probably it'll feel a little bit more like when people blather on a little bit about their dreams.
Yeah, I forget where I've heard this piece of research that said the mystical experience isn't actually really the most significant or the most impactful part of treatment.
It's so interesting. Yeah. And again, this is where ketamine has much to teach the rest of the psychedelic space, because ketamine has been, in my mind, a little bit badly cast with all these different words, with all these different complicated connotations. And that has led to real harms and real oversights. And the same thing, I think, is happening with classical psychedelics, where you're seeing these divergent narratives where, for some people, these are drugs that engender mystical experiences. For others, they are drugs that reset your brain. For others, they are drugs that allow you to break through emotional states. And these things can all be true, and also none of them true, especially for an individual person. Like, it gets very complex.
The chameleon effect.
Yeah, exactly. Maybe ketamine is not the only chameleon in the zoo, but I would suggest general.
I think in its application of
Go ahead.
How it's been used throughout history is where that came from. But yeah,
100%. I'll just say the other name that me and my research team have talked about trying to propose for ketamine instead of the tiger is this goofy drug. Because Edward Domino, again, the creator of ketamine, has this wonderful story where after, I think he dosed the first patient ever in the world with ketamine, went home to his wife and said, honey, I'm working with this goofy drug. It's a beautiful anesthetic, but people get high from it.
It is goofy.
It is goofy.
I think wonky is the perfect word to describe ketamine.
Yeah.
Wonky. Like walking on a slant. If you ever try to walk on it, it's like walking on a slant. That's how I describe it.
100%. And I also think that it's another good example of how interpretations the words we use can totally change what an altered state feels like. For example, the walking on a slant, the ketamine walk, or feeling discoordinated or a little dizzy after a ketamine treatment in our clinic, we always suggest to patients that this is the drug reminding you to take it slow. And I think this is a lovelier kind of interpretation for the same drug effect.
Like a tiger takes it slow.
See, right? Sure they're very
slow, but calculated. Well, if you think about how a cat hunts prey, they take it very slow until they're ready to attack, right? One foot in front of the other, very slowly. Yeah.
Very true. Okay. Methodically.
Yes. I want to start winding this down. So
perfect.
Looking into the future of ketamine-assisted psychotherapy, of psychedelics, what do you think that ketamine in particular, ketamine or psychedelics, can teach us about conventional psychiatric medications and treatments in the future?
So you've heard me make links a little bit to conventional medications, partly because I'm hoping to salvage the reputation a bit, and partly because I do think there are universal features. And one of the big ones is, again, how our narratives shape our experience of pharmaceuticals. And for example, with ketamine, if you go to a private ketamine clinic and you understand it to be dissociative, there's a very good chance you will understand your experience to be meaningless and kind of dissociative. In the same way, if you take a conventional antidepressant with the idea that it's going to fix your brain and that the drug effects themselves are either good or their side effects to be minimized, etc., there's the same sort of black and white kind of lack of nuance thinking that it easily comes up from really well-meaning clinicians. And what I'd advocate more for is understanding that the drug effects are always a product of both chemistry and ourselves. And that's true for taking a conventional antidepressant. If you feel suicidal taking Prozac, it might not just be this random side effect that came from who knows what neurotransmitter. it might be because you felt like the person who prescribed it to you was just totally minimizing your suffering and that this was not the right treatment for you. You know what I mean? That's what I'm hoping for psychiatry going forward, is that we move away from segregating our brains from psychotherapy, which is all about experience, and psychopharmacology, which is all about neurotransmitters, and trying to find places, the ways in which these things overlap and intersect in a really rich and interesting way that could always teach us about who we are.
Sounds like you see a more personalized treatment option for people, more close to who we are.
Yeah, you put your finger on it. And if there's one niche that we're hoping to carve out, we will never be this world leading massive research machine. But if there's one piece that we're hoping to carve out and pursue and push for in the psychedelic field and psychiatry at whole, it's to really understand who people are, both clinicians and patients, and find ways in which that understanding can inform treatment tailoring and really finding the right thing for the right person at the right time.
Beautiful. We're on the same team. I love it.
Wonderful.
That sounds beautiful. Kyle, this has been so lovely, so nice. I get so many ketamine clinics every week that want to come on, and I knew you were the one I wanted to come and teach us about this. So thank you so much for taking the time. I know you're a busy guy.
I appreciate it. It's been really lovely to speak.
Yeah. Do you have any last parting words of hope for people who are listening and who are maybe in the down, depressive, anxious phase right now?
Yeah. I think I'll quote a really close collaborator and friend of mine, Dr. Nicolas Garel, who always says, where there's life, there's hope. And I truly believe that.
Beautiful. Thank you. And how can people learn more about what you're doing? I think you're a chameleon a little bit yourself. You don't seem to have an online presence, but is there any way that people can support your work or get in touch, or anything you want to leave for people?
I guess I'm on a ResearchGate. You can see our publications as they come and I can be messaged, but you're right. Very intentionally, I keep a low profile.
Yeah. That's okay. That's good. We need you to focus on what you're doing. And we appreciate it. All right. Thank you very much. Have a beautiful day. Thanks for listening, everyone. Bye. This episode is produced in collaboration with Film with Integrity. They are a values-forward production studio, and their tagline is quality content crafted with care. And from my experience working with their team, that is certainly true. You can just tell that everything they put out into the world has that human touch from the heart. They truly have that something special that you won't find in most production houses, which is exactly why their work stands out from the crowd. I'm sitting in their video podcast studio as we record this, and that's one of the services they offer. This includes end-to-end production from concept to content. Film with Integrity also does event video, documentary series, commercial and marketing videos, all filmed with integrity, of course. Their home base is here in Toronto, and they work with many American and international clients on productions around the world. If you are working on a project that deserves that quality of production and content without sacrificing heart and soul, visit filmwithintegrity.com to check out their beautiful work and to get in touch with their beautiful team. That's filmwithintegrity.com, and I've linked that for you in the show notes. Thank you so much for listening to and supporting the show. To stay in touch, sign up for my mailing list, which can be found in the show notes or on modernpsychedelics.net. If this episode sparked something within, please let me know by leaving a review of the Modern Psychedelics podcast on Apple and Spotify. This really helps to share these messages with those who need them, which is the whole reason why I do what I do. And if you haven't already, come join the ongoing conversation over on Instagram with other beautiful souls. We have an incredible and conscious community over at the handle Modern Psychedelics. And don't forget that the work begins after you come back down to earth. And I'm standing shoulder to shoulder, doing it with you.